Dumisani Dumelang. Dumisani Mlambo, Umtine Gumapel, coming all the way from Gobalawe, Kwatuzatun, Kwampaza Shainto, Awon City, Nene Tagaze, City of Kings. Yes. So life before COVID-19 was business as usual, basically. But then it was, as the world is going further and further away from more of the African traditions and stuff, going into the Western. So traditional leaders were really so much frowned upon. Religion also came in and made things worse, demonizing a whole lot of stuff. So now, fast forward and then come COVID-19, all of a sudden people are looking for alternatives and solutions because of the panic and the fear. So then now people started, consulting, some, looking into and considering traditional leaders. And then when people came with, the awareness that certain plants can actually work for COVID-19, this and that, then that's when all of a sudden now traditional leaders were well much sought after, and their knowledge and their skills and their expertise. Traditional herbs basically has nothing to do with Western or pharmaceutical medicine. So definitely the belief in the vaccines was not there. And more especially with the whole confusion around the vaccines, which kind of fun. When some people got the vaccine, some experienced this and that, certain side effects and so forth and so on. So that was the time when when WhatsApp platforms and stuff were going crazy with Abo Mkonyane and Abobos and everything. So now people knew that the best way or the best place to get these things was via the traditional healers. So and that actually even gave them more assurance to say our way works. And you see now, look, everybody's flocking. With the misinformation, we will not give ourselves the platform to actually speak much about the vaccines because we have nothing to do with the vaccines. So we'll just simply say, look, based upon your own experience, you make your decision. Because we cannot then tell you to say the vaccines will do this and that. Those are the claims. And those claims may actually be quite false. Perhaps there's other things other than the vaccines that are causing these things. But then Oxalai, which can you as an individual will actually make your choice, maybe take your vaccine, feel whatever you want to feel, and still have the liberty and your own rights to then make your own decision going forward, whether you want to take the vaccine or not. So then that's where we stood with the whole issue of the vaccines and, the side effects and stuff to say, look, if you're going to experience this, that is entirely up to you to then make the decision going forward, what you want to do. So now when it came to the community also traditional leaders at one point were given a platform on, mainstream media, like on news and stuff like that, to also bring in also their own side of the story to say, okay, this is how we work, this is what we do, this is what the law expects of us, and this is the protocol that we should work upon. So they actually had guidelines, to say, look, we were not allowed to actually speak anything against vaccines because we're not in that space, number one. But at the same time also, through things like social media and electronic media, we're able to convey, like a written, documents to say, this is where we stand as traditional leaders. And so we do not cross certain boundaries, which is A, B, C. Like, we do not then, make decisions for individuals. We do not then say or discourage anyone from making any decision of their own, whether or not to take a vaccine or anything of that sort. But then you can still find us in, such A, B, C area. And at the same time, we're guided by the Constitution under section what we say is that we're able to practice, but within these confinements. So then at least I feel that the message was conveyed. Perhaps it was not largely broadcast, but then it was enough just to get to, the necessary people to say, look, we do not mess, we do not cross boundaries. Yeah, during the COVID-19 pandemic, it became a bit easier, especially when things like alcohol and stuff was closed down. So in other words, the hospitals and the healthcare facilities were not overcapacitated. So now, when then everything got open and aka all hell broke loose, it now became difficult in the sense that now COVID-19 cases needed isolation. But then now, since the hospital was, especially the public hospitals, were all jam-packed, so pretty much everyone was put in the same ward, and then people had to wait for beds. So there's not much that was done to boost that capacity to say we're able to, to curb, this influx of people. So then it became much of a challenge. That's why many people were then choosing to do home-based care and self-quarantine rather than going to healthcare facilities. Wow, many lessons. And especially the most important lesson is to really take care of your health, because the best thing is prevention is better than cure. So then if one can try and prevent themselves from getting sick, because quite frankly, when it comes to viruses, we don't really catch them, we earn them. So now, when you earn them, that means your immune system, you're not taking good care of yourself. So that actually woke a lot of people up to start, taking good care of their health, their diet, their lifestyle, and, what they eat and how they live. Because it really just taught us a lot of things. It has actually made us discover even more plants, more herbs. And to be quite frank, I'm actually more of a holistic practitioner, so we don't just deal with the herbs and stuff. We also deal with the diet and the lifestyle, and it has taught us to actually come up with more, ways, solutions, plans, so that now we can, once it comes, even before it comes, we're already ready and we're hitting the floor running.